We all learned in medical school that in patients with WPW, we should avoid giving adenosine beta blockers, calcium channel blockers, and digoxin. But why? WPW is characterized by the presence of an accessory pathway between the right atrium and the right ventricle that bypasses conduction through the AV node. That accessory pathway has a shorter refractory period, which means that it can conduct more rapidly than the AV node. The place where this really becomes an issue is in the patient with AFib and WPW with antidromic conduction, which means that it is conducting down the accessory pathway. The result of this is an irregular, very fast, wide tachydysrhythmia. If you use one of those ABCD drugs in this scenario, you're going to get blockage of the AV node, pushing all conduction down the accessory pathway, and you're going to get a paradoxical worsening of the tachydysrhythmia, and ultimately it's going to degrade into ventricular fibrillation. It's important to note that amiodarone should be lumped in with these medications as well, since it has both beta blocking and calcium channel blocking properties. Fortunately, we do have a drug that isn't contraindicated, and that brings us to the sponsor for this reel, the letter E for electricity. Electricity is the safest way to fix the patient with AFib and WPW. So in AFib with WPW, where you've got that irregular, very fast, very wide tachydysrhythmia, reach for your pads. Electricity is the way to go, and avoid the ABCD drugs.